Hello, my name is Joseph Miller and I am a respiratory therapist. I am part of the respiratory education team here at Gateway Community College. I teach biophysics, anatomy and physiology, mechanical ventilation, and also how to interpret case studies to the students going through the respiratory therapy program here at Gateway. And I've been asked to talk a little bit about the collaboration between the RN and the RTs. So a little bit about my background. I have about 34 years of respiratory care experience, worked mostly in a level 1 trauma center with nurses in the ICU, the CVICU, the emergency room, and also on the floors. And so throughout those years, I had many opportunities to collaborate with nurses in different capacities, in the ICU, again in the ER, where different skill sets are utilized. And what we found is that the dynamics between an RN and RT are vital, that we have good communication, because patient care is the most important thing, and how we work together can make a profound effect on our patients' overall health and outcome. So just a little bit about how the RN-RT collaboration works in the ICU, where I spent most of my time, is that we would have a patient on a ventilator, and then all the ventilator settings and how we're going to manage that patient, we would communicate as far as how much oxygen they were on, how much tidal volume they were getting, how much PEEP, and all that would relate to whether or not we could take someone off the ventilator, liberate them from the ventilator, and then move their status of care to a lesser degree, so that we can get them up and moving and hopefully out of the unit and down to a step down floor, so we can get them ready for discharge. And in the day-to-day management of a patient, I would come in and I would talk to the RN about if there was going to be any traveling. Are we going to the any surgeries, or are we going to CAT scan? Are we going for x-rays? Because that would give me an idea of whether or not I have to set up my transport ventilator, so I can have that ready for when we get ready to move. And then if we were going to do any procedures, a bronchoscopy, or if we were going to do a thoracentesis, or if anything that I had to be around for, so I can make sure I set my schedule so that I'm available when they need me. Another thing we did recently is we would do bedside tracheostomies. We'd use a Blue Rhino trach care kit. And so that was a doctor, nurse, two doctors, the RT and a nurse, all available on the patient so that we could get that procedure done. So in all these cases, how the RN and how the RT gets together is again vital, because how we communicate lets us know. Nurses need vital information when they're doing rounding with the doctors, how the patient's responding to the treatments, if we're giving any breathing treatments on the ventilator, how soon we can get them off. We do weaning parameters every day. And so that information we pass on from the RT to the RN. The RN has it, and then when she's talking to the doctor, he or she is talking to the doctor, that they have information on the patient's pulmonary status. And you put that together with the cardiac status that the nurse already knows, gives you a bigger picture of how the patient's doing. And then the information that the RN knows that the RT may not be aware of, such as fluid status, renal status, the I's and O's. So how much fluid has gone in and how much has come out in a 24-hour period. That can be very important, because if we're not getting our fluid out, the lungs are a tremendous reservoir for holding fluid. And as that fluid gets in there, it can impact the oxygenation of the patient and therefore how they respond. Their heart rate could go up, respiratory rate could go up, and they could have a low oxygen saturation, all because they have fluid overload, which when working with the nurse, was like maybe we can give some Lasix, get that fluid off the lungs, and then the patient will do better in a number of ways because their heart rate will go down, the amount of work of breathing would go down. If they're on a ventilator, maybe we can get them off now that our fluid levels are correct. These are just some of the areas where we have dialogue on how we take care of a patient. Another area would be nutrition. Are we feeding our patient? Because if they don't have enough strength in order to do the work of breathing, they're not going to be able to come off a ventilator. So nutrition and fluid and the drugs that they're on. What drugs are they currently on, and could those have some kind of impact on their mental status and whether or not I'm trying to do weaning parameters. If I haven't conferred with the nurse ahead of time, I may be trying to do weaning parameters when the patient is not awake enough, and he'll fail his the weaning parameters test only because he has not had enough consciousness, his level of consciousness is not high enough. So if I'm smart, if I'm a good therapist, I've already talked to the RN, I know when she's going to taper down the drugs, especially like Diprivan, so we get the patient a break from that. So we wake them up, find out how their mentation is, and then I do my weaning parameters, and if need be, then we can put our drugs back on and let them rest. So in all these areas, the RN, the RT, are always working together, side by side, in the bedside, in order to have a better overall positive outcome for our patient. So let's switch to another scenario on the floor where the RN is taking care of a number of patients and can't individually look at each respiratory status, but the RT can. And when he goes in, or she goes in, and takes care of that patient, they can notify the RN whether or not their mental status has changed, whether oxygenation status, their ventilation status, anything that give them early warning that you may have to call a rapid response and get help to this patient quicker, because time is tissue when it comes to oxygenation. The longer we go without the correct amount of oxygen, the more tissue dies. So those are just some of the areas that there are collaboration between the two. And in most all hospitals, the respiratory and the nursing, they seem to flow together. They just work together because they can be for our nurse, the RT can be your best friend. Looking to them if you want to look at analyzing a blood gas, or what should we do in the management of ARDS, or how should we set up our parameters if we're in an advanced mode like APRV. All these things, the respiratory therapist, that's our bread and butter. That is what we have gone to school to become experts in those areas. So the nurses don't have to be. It's good if they have an overall knowledge of all of the respiratory issues and how ventilators work and the different modalities that we can put people on, like high flow nasal cannula or on a BiPAP or whatever we use to help the patient out. It's good if you have an overall idea of how it works, but the intricate knowledge, that's what we specialize in. And knowing where your RT is, how you can contact them, how they can be an asset to you, helps you take some of the work off your plate, because you are responsible for the whole patient. The endocrine, the neurological, the renal, the respiratory, all these different areas. Utilizing the different allied health specialists helps you do your job more efficiently and more effectively. So I hope this has been a good overview of how the RTs and the RNs can work together. And through my 34 years, I've had wonderful, wonderful experiences with nurses. I still remember today how one of the best feelings is how, as a team, that we've been able to take someone who's critically ill and return them to health. And we bring parents and reunite them back with their children and children with their parents. And it has intrinsic rewards that cannot really be found in any other job that you can do, any other career. The one of helping somebody else have a better quality of health. And so I applaud all of you who are going through nursing. My own personal view is it's a noble endeavor that you are using your time and your talent to help somebody else have a better quality of life. That is very noble, and so you should be applauded and celebrated for the life choices that you're doing. And so thank you for your time and attention.